Hi, I'm Dr. Rhonda Lowe, and welcome to Your Medical Pipeline. And what we're going to talk about in this segment is no sweat. The average adult loses about a liter of fluid a day in perspiration, an amount that's barely noticed by most. But if you suffer from hyperhidrosis or excessive sweating, you're going to lose way more than that, and surprisingly, you're not alone. It's a common problem, and a large amount of sweating can affect your confidence, wreak havoc on clothing, and can make you feel self-conscious. It's not just a problem that's limited to the summertime heat either. It can affect you all year round. Although the exact causes of hyperhidrosis are unknown, the good news is there are treatments that can help reduce sweating or stop it altogether. Treatment that can have a positive impact on a person's quality of life. About 40% of people have a family history of the problem. Diets such as hot, spicy food and stress can make the condition worse. And if you've had the condition all your life, usually you don't need to have any further medical investigations. The common antiperspirants or deodorants are often not enough for people with hyperhidrosis. Some need the extra duty antiperspirants containing 12 to 15% aluminum chloride, liquid or gel. But the trick is they must be applied 8 hours in advance and then not washed off to be effective. Another option is the use of iontophoresis, or an electrical current machine that's applied to the palms, soles, and armpits to temporarily stun your sweat glands and stop them from sweating for up to 24 hours. The downside is the treatment needs to be repeated frequently and is often only moderately effective. Then there are Botox injections. And yes, that's the same Botox that's used to fight wrinkles, but it's also used to effectively treat hyperhidrosis. It works by temporarily blocking the nerves which stimulate your sweat glands. It can be used for sweating in the hands, underarms, along the hairline on the forehead, and even your feet. The procedure usually involves 15 to 20 injections at the site of the excessive sweating, and it can stop the problem for 6 months to a year. Really though, the cost is an issue since each treatment can range from a few to several $100s depending on the dose you need. Still, many say it's worth it for the savings in dry cleaning bills alone. Now, when it comes to surgery, the latest for excessive sweating, in the armpit particularly, or in the hands, is a minimally invasive fiber optic procedure that's done through the chest to cut the nerves to the glands that produce the excessive sweating. The key, though, in dealing with hyperhidrosis all around is finding the treatment that works for you. You may want to try the least expensive and least painful options first before moving on to something more invasive. My comments are for information only and should not be used to replace a visit or the advice of your physician or other healthcare providers.